point. Let me begin with you, Dr. Mundia.
Well, to prepare better is to strengthen strategically what you already have. So we don't have enough healthcare workers in the system, and you need to bring in more to address the numbers in case one day or in case some of these issues spiral out. So you need to have enough workforce, enough nurses, enough clinical officers, enough doctors providing services and ready to provide services adequately to persons going to be affected. So any day we should not be saying we don't have enough doctors. But the situation as we speak right now in the county government, we don't have enough persons providing services. And even as we speak right now, we still have a number of county governments that do not have those isolation facilities or facilities to stabilize persons who get sick. Unless we condemn them and say, once you get ill, it is what it is. We cannot try to stabilize or save you. We'll just wait for your last days because we cannot
do anything,
put you up somewhere to stabilize you as you're probably trying to recover. So if we want to save more lives, then we should have adequate facilities also put up, like ICUs and those stabilization machines so that persons get to pick up better. So the other thing that we need to do is to have more education, public health-wise, to have persons know that in case there are any kind of disease of this kind, this is how we manage them. If you suspect you've been this kind of, don't hide. Show up so that we get to stabilize you. But now persons may want to hide because once they know that they are unwell, they want to try first of all whether by themselves first they will survive the disease. But if they're coming into contact with other persons, they get to have the risk going up. So if persons are more confident about services to be available at wherever they'll go, they'll come out and they'll be able to be managed in a particular way and they're good. The other thing is to continue doing research, set up facilities to stabilize research information about diseases or cures for this kind of conditions. We've started issues or discussions about vaccine manufacturing or research, and I think that is one of the facilities that we're working at Laikipia and many others. So we should improve or make more opportunities available for our local people so that they get to also participate. And even when they're participating, not to be discriminated against, because sometimes you find that it's the experts who are getting preferential treatment and better payment for working in those facilities rather than ourselves who collect the samples, who go to the lab and work in those particular studies. We've had a case in the past whereby there were doctors who participated in some of the malaria vaccines and all that trials, and they were never recognized. And right now we are having malaria being, having cures for it, but the persons who put effort into that kind of discoveries, they were never recognized. So if such events come here, we get to work with the data, we should have our Kenyan people recognized and their labor not to go into waste like that. Yes.
Lillian, you know, if you're to advise the government, you know, on what needs to be done now, I know we want to be of support and of help and we have all those agreements, but then what should be the priority now?
I think the priority right now is for the government to slow down. By slowing down does not mean that they stop the process, but they should calm down and dialogue with people. So that, because one of the uproar that we are finding in the society, in the nation right now is the fact that, like even my colleagues are saying here, even the way the information was broken down to us was not the right way. So that is something that the government should outrightly admit that that was an oversight on their side. So dialogue and just, again, they need to come outright and explain to us what is it in this pact that you signed. Like he's saying, we need to know what is it there for us, so that, because again, as we are agreeing that it's not about the quarantine facility that the people are against, but it's the whole process around it and how everything is, how they maneuver around about it. So the government should just engage in dialogue with people. They should swallow their pride and just come and explain to people exactly, this is what the pact contains, this is what we stand to benefit, and of course put the measures that the document is saying, whereby we are going to appreciate and acknowledge the services, or rather the efforts of our own people, and not just water down and think that because it's a US thing, then it's all about the US. So one thing that I want to say, this open dialogue with people, with the stakeholders, they should not just assume that it's just about the two governments, but their stakeholders here in Kenya, people who are going to be playing very primary roles in the whole of this. They need to be involved in every stage of this project so that they can own it, because where the uproar is just a sign that the people have lost trust in the nation. And how do you build trust? You build trust by swallowing your pride and coming down to people's level and explain to them exactly what you're doing and give them even a head start of the benefits that is going to come with this. Because I know our president knows, he must have sat down and he knows very well that for him to sign this pact, or rather to agree to this, there must be benefits for this nation. As the leader of the nation, he has the best interest of the nation at hand.
All right. I want to take a quick tweets, and then I'll give Peterson a chance to also give us, your thoughts. Let's look at what Kenyans have been saying on social media with regards to the conversation we've been having. Bob Otieno, we know it's good court suspended madness of Ebola. This regime is indeed incompetent, placing foreign interests over national well-being. Slavery is still in motion, and the difference this time is that there is no physical chain. We have Babu Michael, KE, about the proposed Ebola quarantine center. I think the controversy comes more where the government secretly wants to establish the center. The general public feel left out, and the so-called public participation hasn't been done to rule out the doubts and negativities. We have Elkana Okwiri, Safin, my thinking with the Ebola thing is the America wants to rip off Congo's minerals through Kenyan military, but hiding under Ebola. Interesting. Babu Michael KE, the whole uproar about the proposed Ebola quarantine center mostly comes from trust issues. Most Kenyans at the moment don't trust the current government on implementing certain issues. They have messed up in the past, and the general public can't believe them. We have Samuel Oworth. No responsible government waits for a deadly outbreak before taking action. Investing in preparedness protects lives globally. Shouldn't leaders encouraging public awareness and instead of should leaders be encouraging public awareness and instead of turning health initiatives into political contests? That's a question there. MC Rumors, I think President Ruto is not patriotic enough. Trump talks about America first. Why not Kenya first? 2, let America quarantine their own citizens in their own country. We don't want that facility here. Ruto can build it in State House if he wants. Please, Trump. Okay. Kenyans. Let's hear your thoughts, Peterson, on the way forward. How do we clean this, what Dr. Mundia termed? It's an ugly situation we found ourselves in as a country. How do we make it tidy?
It is. And as I said again, Kenyans are not wrong because they are using the information they have. And that is why I keep on saying that for us to get out of this, in public health, we usually say facts over fear. When you give facts, fear dissipates, because fear thrives where there is no enough information and people do not know how to protect themselves. And I associate myself with the comments of my colleagues here. We have done an advisory to the ministry as people who had gone to the West Africa. We wrote to the ministry and on what needs to be done. And that was acknowledged. I know it's something that is in the process. We were there for a meeting yesterday, and even today we will be there. So what we need to do, very aggressively, we need to send out. We have risk communication team. Imagine we have these people even at the ministry. We need to send them out aggressively. We need to send them. We need to sponsor this content through the media so that the people will be able to understand Ebola, to understand what they need to do. We need to get a number where they can be able to call and report so that the community can be able to identify these people. Once the community, of course, has been empowered with the information, then we need to look at the health workers and the facilities we are going in. And I agree with Dr. Mundia that, one, we need refresher training. We dealt with COVID-19, but every time you have an outbreak, you must do some refresher training because it is highly contextual so that you update the health workers. But also, we have a shortage of health workers. And we have some really good groups with some sort of experience that we lost, like the COVID, it was called CHAP. COVID-19 Health Emergency Response Program. We used them during COVID-19 and dumped them. We have the other UHC medics. These are people who had some sort of experience that we can quickly hire back into the system and retrain them so that they can boost the numbers. We have the UHC that also we are having issues in confirming them on permanent basis. And these are people who also came during COVID-19, and they have some good experience in that. So this plus bringing more health workers into the system, because also you want where every facility that a Kenyan can go to, they are going to find a competent health worker. We still have health centers and dispensaries that do not have a clinic officer, that do not even have a nurse somewhere in some areas of this country. And that means that you'll not have somebody probably who is competent, who can be able to suspect and identify. Our diagnostic capacity is good. So what I'm trying to say is that the capacity is there, because capacity means the resources are available. It is activation. We activate our risk communication and community engagement. We activate our health workers by boosting their numbers, by retraining them, by providing them with the logistics like PPEs and what have you. And of course, now when we get a case in the country, if we will have done that, it will be very easy for us to pick it up. We are going to quarantine and we have the experts. When we go to isolation, we have the experts, and we'll be able to contain this disease.
All right. Yeah. Peterson Wachira, thank you for saying that, and allow me to end it there. I wish we had more time, but it is a conversation that we will definitely continue having in the coming days. Peterson is the chairman of the Kenya Union of Clinical Officers. I've also been engaging this morning the deputy chairperson, Kenya Medical Practitioners and Dentists Union, Dr. Kahura Mundia, and also Lilian Acheng, a health systems expert. Thank you, ladies and gentlemen, for creating time. We're taking a very short break. We are coming back with much more.